My name is Peyton Flowers. I will be graduating from Nebraska Methodist College with my Bachelor's of Science in Nursing in April of this year. This is my Educated Citizen Portfolio presentation. Welcome, and I hope you enjoy. So the public issue that I chose to talk about was sex trafficking in Nebraska. Sex trafficking is a multi-billion-dollar industry. Victims have been reported in all 50 states in the United States, as well as multiple countries throughout the world. My biggest goal is to advocate. As a future healthcare worker, we need to learn to advocate for victims and advocate for potential victims that may not want to speak up. If we're not able to identify someone that could be a victim, we're not going to be able to help someone. So by being educated on what to look for in a potential victim, that is how we as healthcare workers are going to do the most good. If you look in the bottom right-hand corner of this PowerPoint, I put some red flags for human trafficking. Just to start things off, this would be something that would be great to have hanging in an emergency department or a walk-in clinic throughout the city of Omaha. Some red flags are tattoos and branding across the arms, someone carrying wads of money, multiple credit cards, hotel room cards, someone who is being accompanied by someone who will not let them talk. Those are just a few examples. Greater than 50% of trafficking victims have reported that healthcare providers were the first people that they've had interaction with after escaping. That means we're the first people seeing them. We're the first people laying eyes on them. We want to get all the information we can. I personally believe that healthcare workers need special training that make them aware of the signs to look for in someone that may currently be being trafficked or someone who's doing the trafficking. Throughout this PowerPoint, I'm going to tie back what I have learned in the past 4 years of becoming an educated citizen, and I'm going to relate those back to my public issue of sex trafficking. Okay, so let's talk about what it means to be a change agent. To the right is the definition of the change agent. So a change agent takes the appropriate initiative to effect change. We create a voice for ourselves as well as others. In the next two slides, you will see two examples of when I was a change agent throughout my time here at Nebraska Methodist College. So the first time I was a change agent, we have points on the surgical floor. I work in surgery. And we are the ones, I'm a CNA on there, we are the ones that pre-op the patients. I work on the cardiovascular and neurosurgery cases. When a patient is not taken back to the OR on time, people lose points. It's called a late case start. So I'm working with multiple disciplines. There are times when the surgeon does not call the patient back on time to get pre-opped, therefore the whole routine gets started a little bit late. That patient is ultimately late to the OR. The CNAs were the ones that were losing the points for this. I thought this was unfair. The surgeon was the one that was taking their time calling the patient back, therefore they were the ones that should lose the points. What I did in this situation is I advocated for myself as well as my coworkers. I advocated this was not fair that the CNAs were the ones losing the points because we had everything done on our end. I also advocated for the patient. I advocated for the patient by saying that this patient is rushed when we get them back there. This just makes their whole process much more stressful than it needs to be. By doing this, I learned that it is okay to advocate even when you're uncomfortable. It's okay to advocate even when there's multiple disciplines around. I also learned how important it is to address a situation that needs to be changed directly. If you go straight to the source, that's how something is going to be changed. The tieback I have to this is now that I know how to advocate for things and how to get something to be changed directly, I now have the knowledge to advocate for the continuing education credits for mandatory sex trafficking courses for healthcare workers. I believe that by teaching every healthcare worker, whether it's in an emergency department or a clinic, on the signs to look for sex trafficking or potential victims to look for or things to look for in a potential pimp, this is going to help. I'm not going to get there unless I advocate. My second experience was my senior clinical experience. I did my geriatric rotation and we were required to care for 2 patients. We were required to do an EBP fall risk tool on a patient that was older than 65. I had one patient that was elderly, older than 65, but one patient that was only in her 40s. My patient in her 40s had many more comorbidities than my patient that was elderly did. I ultimately found out that my patient that was in her 40s would benefit more from this fall risk tool and education on falling much more than my elderly patient would. The lesson learned from this experience was advocating for patient safety, even if it means going off the beaten path. So although this isn't what I was supposed to be doing it on, this was going to be better for my patient all around. This also taught me to look into things that the patient might not be telling you because they're embarrassed. My patient, for example, was a little bit overweight. She wasn't admitting that to herself, so I had to acknowledge that. I had to acknowledge the risk factors that she was more susceptible to because of that obesity. The tie back I have to this for sex trafficking is going to be that your victims might not be those stereotypical victims. And that is all the more reason why it's more important for us as future healthcare workers to look for those little hints that are going to let us know what we need to focus more on that patient. This is going to be a change agent. This is what's going to implement change in the future, and it creates a voice for you as well as others. We're now going to be talking about what it's like to be an effective communicator and a couple examples I have had throughout my past 4 years at this college and how they've helped me become an effective communicator. So to break it down, an effective communicator, they use appropriate oral and nonverbal skills. We're able to identify those nonverbals, as well as using Spanish or other languages to incorporate with our learning. So my first example relates back to a Spanish course I took at Nebraska Methodist College. My freshman year here, I took healthcare in Spanish, and this came in handy at work one time. My experience was when I was working with a Spanish-speaking patient at work. She was getting a procedure done. I, as the pre-op tech, had to ask simple questions such as, when was the last time you had anything to eat? Did you shower? Do you need to use the restroom? I easily could have gotten an interpreter in there, but I thought back to my Spanish. I had faith in myself, and I was confident enough to ask these questions. The lesson I learned from this experience was to put forth that effort and try, because it ultimately makes the patient feel more comfortable. I also learned how to communicate with different nationalities. I learned body language. I learned how to point to your hair, to your mouth. The tie back I have from this experience to my public issue of sex trafficking would be that these victims are already going to be nervous to talk to someone. As a healthcare worker, it is so important to do anything you can to reduce the amount of people that person must retell that traumatizing story to. My next experience of how I became an effective communicator was when I had a distraught patient at work. During COVID, we had no visitors allowed on the surgery floor. I had a patient that was getting a very invasive heart procedure, and he was very scared. Although he was not telling anyone he was scared. He was in his pre-op bay, and he was playing sad music very loud. He was banging on the walls to try and get attention from everyone. No one else went in there. I knew that he needed someone to talk to. So I went in there and talked to him and ultimately sat with him until they took him back to surgery and found out that he was just scared. He was nervous about anesthesia, he was nervous about recovery, and he just wanted to talk to his family. The lesson I learned from this was that you don't know what someone else is going through. There's so much on the inside that no one tells, and it does not show on the outside. Another lesson I learned from this is how important it is to use that verbal and nonverbal communication. It is our job as healthcare workers to pay attention to those nonverbal cues. That is ultimately what is going to help us. The tie back I got from this experience into my public issue was how important it is to teach healthcare workers, especially those that are in quick-paced environments such as the emergency department, quick C clinics, surgery, on the importance of listening to and picking up on those nonverbals. And finally, we have the reflective individual. So a reflective individual, the definition is to your right. To break it down though, a reflective individual uses logic and critical thinking as well as holism, and they take personal responsibility. So my next two slides are going to be examples of when I have been a reflective individual. My first example was when I had to write an argumentative analysis paper my sophomore year in this college. For this paper, I had to write about something that bothered me, an argument, and I had to take a side on the argument. I wrote a paper about prescription drug prices and how those drug prices should be shown on television commercials. The lesson I learned from this was putting myself in others' shoes. This can be misleading. I learned that just because something does not affect me personally does not mean that I should not care about it. Just because I do not take a bunch of pills doesn't mean that I shouldn't care about someone else that does, and those prices might affect them. I can tie this back to sex trafficking because this experience taught me to find resources when data is misleading. This also taught me that although I have not personally been affected by sex trafficking, I still have a responsibility to acknowledge that people are. So therefore, even though these nurses may not have personally been traumatized by sex trafficking themselves, it doesn't mean that they shouldn't work their hardest and be educated enough to find resources to help a patient. My second experience was on my pediatric rotation. I did this experience at Children's. There was a patient receiving chemotherapy and his mom needed a break, but she didn't want to leave her young son alone while getting chemotherapy. I ultimately decided to tell the mom to go down to the cafeteria, have a break, go for a walk outside. I will sit in the room with her child. She was overjoyed. She was so excited that someone acknowledged her. The lesson I learned from this was just never stop being a decent human being. Put your personal thoughts aside. Even though I could have caught up on charting, caught up on homework, I decided to sit in there with that child to let that mom have a break. The tieback I have to this is to never assume that someone is okay just because they're not saying anything is wrong. We need to consider the needs and the resources of the very vulnerable population of sex trafficking victims. To wrap up this PowerPoint, I feel that throughout the past 4 years at Nebraska Methodist College, my education as well as my experiences have allowed me to become a change agent, an effective communicator, and a reflective individual, ultimately becoming a very holistic, educated citizen. I feel as if the education that I have received at Nebraska Methodist College has made me more aware and much more educated and confident about sex trafficking and the importance of the public awareness of this issue. Thank you so much for listening to my Educated Citizen portfolio presentation, and thank you so much for the last 4 years at Nebraska Methodist College.